Hi, my name is Naomi Kiprotich. I'm a nurse practitioner student from Maryville University. I have LB here as my volunteer for the 8 to 12 video assessment for today. Prior to this, I did a full set of vitals, height and weight, and I did the near fusion with Rosenbaum and Snellen chart for far fusion, and everything was within normal. I had the patient also put on a gown, empty the bladder, and we wash the hands. I also assessed for the gait, for stability, and it was normal also while I was doing eye assessment. I'm going to start with inspecting her for general appearance. She appears clean, appears healthy for the age, dress appropriate for the season, and for the season and the day. She's not too dressy. I'm gonna start inspecting the head. I don't see any deviation, any protrusion of the scalp. I'm gonna go ahead and start palpating. I'm feeling for any nodules, any lumps anywhere. Do you feel any pain while I'm doing that?
No.
I'm also gonna feel the texture. It's normal for the ethnicity. I'm gonna inspect the scalp for any lesions, nodules, any rash, any signs of infection on the follicles. They don't pull out easily. The hair is black in color and pulled back with a ponytail at the back. Next, I'm gonna come to the facial. I'm just gonna look at the face for the placement and symmetry. The color is there are no colors for eyeball or eyeball pigmentation. Skin is intact. I don't see any lesions, nodules, or rash. I'm gonna inspect the eyes. The eyes are for the eyebrows, eyelashes. Eyebrows are full and intact, and no signs of infection. Eyelashes extends outwards. I don't see any signs of infection either on the eyebrows. I'm gonna palpate any pain there.
No.
It feels smooth. Also, while I was doing the hair, there is no signs of alopecia. I'm going to palpate for facial bones, any pain while I'm doing that.
No.
While I'm palpating, I'm gonna go ahead and palpate the sinuses, the frontal for any edema, any pain,
No.
any tenderness. I'm gonna come to nasal, any pain, any tenderness. I don't feel any masses or any edema. I'm gonna come to maxillary, any pain.
No.
Okay. Also, while I'm palpating, I'm gonna do the lymph nodes, preocular, postocular, occipital, superficial cervical chain, posterior cervical chain, deep cervical, subclavicular, infraocular, and axillary. Any pain while I was doing that?
No.
Also, I'm going to check for the eyes. I'm gonna check the sclera and the conjunctiva. I'm gonna shine the light. Sorry, look at me. The sclera is white, no signs of jaundice on both sides. The conjunctiva is pink and moist on both sides, no signs of lesion. Nodules there, no signs of extra tearing. Also, I'm gonna check for the eye movements. I'm gonna do cover and uncover test. I'm gonna do confrontation for pupillary, for it should be straight and consensual, the pupil. I'm gonna do the 6 fields. Okay, I'm gonna have you cover and look on the something on the wall. Cover the other eye. I'm looking for any jerking, any trophismus, any nystagmus. I didn't see anything on both eyes. Next, I'm gonna do the confrontation. I'm gonna have you cover your right. I'm gonna cover my left. When you see my finger, say now. Okay.
No. 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 No.
Okay, I'm gonna do the other side.
No. No. No.
Okay, I've been again I'm checking for any that's for confrontation. Next I'm gonna have you look at me. Don't move your neck or your head, just follow the reflex hammer. I'm checking for any signs of nystagmus, strabismus, or extra jerking on both sides. Okay. Next, I'm gonna have put the pen light. Make sure the pupils are consensual and straight. Okay, they are both consensual and straight. Next thing I'm going to do the ears. I'm checking for placement and symmetry. They both look asymmetrical. I'm gonna palpate for the auricle. It's nice and smooth. It's removable. When I check behind the ears for any nodules, any lesions, any skin rash, I don't see that. The pinna lines with outer canthus of the eyes. Next, I'm gonna check for the tympani and ear canal. I'm gonna put the light. The tympani should be gray and pearly. I don't see any suramen, extra suramen on the ear canal. I don't see any lesions, any nodules, any discharge. I'm doing both ears. And the tympanic membrane is gray and pearly. Next, I'm gonna come to the nose. For the nose, I'm inspecting for the placement and symmetry. It's midline. The contour also is symmetrical. I'm gonna palpate. Tell me if you feel any pain.
No.
Okay. I'm gonna also palpate for the lacrimal apparatus. Any pain?
No.
Okay. I'm gonna shine the light on the inside the nose. It should be pink and air is equally distributed. The septum should not be deviated. It's midline. I don't see any signs of lesions or nodules. Next, I'm gonna check for the nose patency. I'm gonna have you close your right nose and breathe in. Do the other side. Any issues doing that?
No.
Then both noses are patent. Next, I'm gonna inspect the mouth by starting with the lips. The lips are not dry. There are no fissures, both on the lips and the corners of the lips. Next, I'm gonna check inside. I'm gonna have you open your mouth. The tongue is pink. There are no signs of thrush. I'm gonna check for the buccal mucosa is pink and moist. I don't see any signs of lesions or nodules. I'm gonna have you. I'm gonna check the teeth. The teeth are full set, no chip, no signs of bleeding gums, no cavities visible. I'm gonna have you lift your tongue upwards. I'm gonna check the floor of the tongue. I don't see any nodules, lesions. Side of the tongue move sideways. Lateral signs. I don't see any lesions, nodules, or masses. Could indicate cancer. Teeth are white. I don't smell any unusual odor. Okay. Next I'm gonna do a series of facial movements. I'm gonna have you bob your cheeks, clench your jaw. I'm gonna check for temporal mandibular joint. Any pain?
No.
I don't hear any clicks or cracks on that. I'm gonna have you take your tongue out, smile, put your tongue sideways, move sideways. I'm gonna have you frown your forehead, raise your eyebrows, close your eyes tightly, and that's checking for cranial nerves. I'm gonna check for sensation. I'm gonna have you close your eyes. Tell me if it's sharp or dull on both the cheeks.
Dull, sharp, sharp, dull, dull, sharp.
I'm gonna do that on the hands too. Put your hands on the side. Okay.
Sharp, sharp, dull, dull, sharp.
Okay, I'm gonna do on the legs too.
Sharp, dull, 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 sharp, sharp.
Okay. Next I'm gonna check for the I'm gonna come to the neck. I'm gonna inspect for frontal and back. Skin is intact. I'm gonna go ahead and palpate the trachea, make sure it's midline, and palpate for thyroid, make sure it's not swollen. Feeling for any pulsation or thrills. I don't feel that. I'm gonna inspect for jugular vein distension on both sides. Tilt your neck that side. I don't see any distension. Come this side. I don't see any distension. I'm gonna feel for carotid one at a time for pulsation or thrills. I don't hear any of that either. Next, I'm gonna auscultate the carotid, fellow the stethoscope, and then the thyroid. Okay. And then same thing one at a time. And I don't feel any thrills or pulsation. Next, I'm gonna do range of motion and resistance. I'm gonna have you turn your neck sideways, tuck your chin on your chest. I'm gonna have you tilt your neck backwards. I'm gonna have you touch your hair on your left shoulder, the other side too. Going to do the resistance. Push your hand against your cheek against my hand, the other side, backwards, forward. Shrug your shoulders. Okay, go ahead. Push against mine. Okay. I'm gonna have you extend your hands outwards. Feeling resistance again. Okay, your legs. Push against my hand. Okay. Okay. I'm gonna do the bottom of your feet. Raise it up. Push against my hand. Okay. Alright. While I'm down here, I'm gonna feel for the musculature, for the tone and mass. I'm gonna inspect for air distribution. I'm gonna feel for the temperature at the back of my hands. It's warm and moist. Skin is intact. Hair is equally distributed. I'm gonna go ahead and check for capillary refills on both. Should be is less than 3. I don't see any signs of cyanosis or capping. While I'm here, I'm gonna check for popliteal pulses, posterior tibial. I'm gonna check for dorsalis pedis. Okay. Popliteal at the back of your knees, dorsalis pedis, and then tibial. And there are 3 plus. I don't see any edema either. I'm gonna check for the arms, for the musculature, tone, and mass. Any pain while I'm doing that? Hair should be equally distributed. Skin is warm and moist. I'm gonna check for capillary refills. No capping, no sign of cyanosis. Is less than 3. I'm gonna check for radial pulses. That's brachial pulses. Radial. It's 2 plus. Also, I'm gonna check for reflexes while I'm here. I'm gonna check for brachial. I should see the tracking of your hand just freely. Okay, that's radial. Okay, sit up and relax your knees. I'm gonna look for jerking. I'm gonna check for tendon. Okay, they are all intact. Next, I'm going to inspect the chest for a smooth, symmetrical rise and fall, no nasal flaring, no signs of accessory muscle use, which would indicate difficult breathing. The skin is intact. There are no signs of lesion or nodules, no rash. I'm going to palpate. Tell me if you feel anything while I'm doing that. While I'm going also to palpate for pericardium. For pericardium, I'm feeling for thrills, heaves, and pulsation. When I feel for article, pulse. Okay. Next, I'm going to do. I'm going to go ahead and listen for arc sounds and breath sounds. I'm going to check symmetrical. Start with breath sound using the diaphragm of the stethoscope. Take a deep breath for me. Comparing both sides. Deep breath in and out. Deep breath in and out. Okay. While I'm here, I'm going to go ahead also and auscultate for heart sounds. Right aortic, second intercostal on the left for pulmonic, third intercostal left for arch point, fourth and fifth for tricuspid, and fifth is on mitral. Also, I'm gonna go ahead and listen, auscultate for lateral aspects of the lung fields, and then I will listen. Take a deep breath. Okay, while I'm auscultating for breath sounds, I'm listening for wheezes, bronchi, trails, which would indicate also respiratory issues. Also, I'm going to focus for resonance in a systematic manner. I'm just listening for changes in resonance. I'm gonna have you extend your hand so I can check for lateral aspects of the lungs. Again, I did not hear anything unusual as well. I'm gonna do the tactile parameters. Again, I'm checking for resonance. I'm gonna have you say 99, 99. When I put my palms of my hand.
99, 99, 99, 99.
Okay, I'm gonna do the last one.
99.
Okay. Next, I'm gonna have you lay down. Okay. So basically what I'm going to do, I'm going to start inspecting the stomach. Now for skin color, symmetry, I'm going to look for any pulsation movement, and I don't see any of that. Skin is intact, no colors or areas of eyebrow or pigmentation. After inspection, I'm going to auscultate for vowel sounds, and I'm going to auscultate for pulses, aortic, renal artery, iliac, bilateral, and femoral. Okay, I'm going to use the bell. Aortic, right, renal artery, left, iliac, the side of the umbilicus, left and right, femoral artery, left and right. Okay. I'm going also to listen for vowel sounds, right upper quadrant, nice calculs and clicks, left upper quadrant, uh, left lower quadrant, right lower quadrant. And also if I listen for about, I'm listening for about 2 to 5 seconds, and if I don't hear anything, I listen for up to 2, because sometimes there's power obstruction when you cannot hear anything. Next, I'm going to do percussion. I'm going to percuss the borders for the spleen and liver and kidneys. On the liver, I'm gonna percuss starting on the mid-clavicular, and also I'm going to percuss going upward and downwards to check the measurement. When the sound changes, I mark it. Come from downwards, changes, and it should be between 6 to 12, and I will do both sides as well. I am going to palpate, starting with light palpation, and just first of all, before I do the palpation, I have to percuss the abdomen, also for resonance, for tympanic, and dullness for solid organs areas, and tympanic for air filled areas. I'm going to do light palpation, going just around the stomach, feeling for any signs of masses, any pain while I'm doing that, or tenderness. Okay. I'm gonna go ahead and inspect the spleen by doing the deep palpation. I'm gonna start on the right side and just go deep palpation. Anything tenderness there?
No.
Okay, I'm going to palpate for put my left on the underneath and do the deep palpation and feel for the liver and the kidney borders, which I don't feel that. I'm gonna have you lay on your side so I can do the kidney, the spleen. I should not kind of have it underneath. I don't feel any. Okay, if you feel the spleen, it indicates that it could be enlarged. And next, I'm gonna have you kind of sit upwards a little bit. I'm gonna feel for the skin mass, muscle mass. Okay, those are intact as well. I'm gonna have you sit up and face the wall. Okay, I'm going also to auscultate for the breath sounds, and I'm going to inspect to see if there's any use of accessory muscles. I'm going to measure for thoracic expansion. I'm going to do diaphragmatic expansion, which should be about 3 to 5 centimeters, and I'm going to do costal vertebral angle for any tenderness on the kidneys. Also, I'm going to inspect the cervical and lumbar spine. The skin I had inspected is intact, no signs of lesions or nodules. I don't see any protrusion or bones. I'm gonna start doing the power sound, breath sounds. Take a deep breath. Again, I'm listening for any wheezes. And I will do both sides and compare as well. There are no signs of wheezes, bronchi, or rails. Next, I'm going to percuss again for resonance in a systematic manner. And on the lateral. Okay, and there are no hypo or hyperresonance heard. Next I'm gonna do the indirect percussion for costovertebral angle for any signs of tenderness. Do you feel any tenderness?
No.
Okay, next I'm going to do chest expansion, thoracic expansion. Take a deep breath. Okay, and it equally expands. I'm going I check the percussion for the changes of resonance. I'm gonna do that and measure. Should be like 3 or 5 centimeters. It changes. I'm not right there. Start from the bottom. Coming up, and it's right there. And I should measure 0 to 5 centimeters. Next, I'm gonna do the tactile parameters. I'm gonna have you say 99 when I touch you.
99. 99. 99.
Okay. Next, I'm going to compare the anterior posterior configurations, and it's 2 to 1, which that's the normal value. Next, I'm gonna have you stand up. And face the wall. I'm gonna have you lean forward. I had to inspect the cervical spine. Going to palpate any pain.
No.
I don't feel any protrusions, any masses or nodules. While you leaning forward, I'm looking for lean forward more. Looking for the curvature. It should not be deviated. No signs of scoliosis or kyphosis. Go ahead and sit down. I forgot one thing. The hearing test. I'm gonna go do that. I'm gonna strike the fork on the turning fork on my hand and put it on top of your head. And if you hear a sensation, right or left, let me know on both.
Both.
Okay. I'm gonna do the mastoid bone. I'm gonna do the same thing, and whenever you cannot no longer hear, let me know, and then I put on top of your on the front of your ear. If you cannot hear, let me know.
I can hear.
Tell me when you no longer hear.
I can no longer hear.
Okay. Tell me when
I can
you
no longer hear.
okay. And I would do on both sides as well. And that's comparing bone to air conduction. It should be 1 to 2. And I think that concludes the video presentation. And I want to thank you again for coming.
Okay.